Okay, I'd like to call this meeting to order. This is May 28th. This is a special meeting. Be a discussion on possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding the COVID-19 and taking any necessary actions based upon the updates.
Good afternoon, Madam Chair, members of the board. I have a few items to update you on. The first is that we'll be reporting out on the hospital capacity report, as we always do on the Thursdays.
Madam Chair, is your speaker up?
It is this person. Yes.
Can't hear, but yeah.
Okay. Do they need to check any? There we go. Is that better? Okay. Okay. Thank you. As of now, it looks like ICU bed availability is still solid, and there's space. I do notice that some of the numbers changed, and I believe they've opened up additional capacity. As I understand it from at least WARMC, they've done that not as it relates to COVID-19, actually. It was related to other trauma cases that they've admitted into their hospital, and that actually is driving their need to actually increase their ICU capacity. Just an update on the neighboring counties. So in Laughlin, they still show less than 5 cases in their county or in their community, and Needles now has 2 cases. And I'm sure some of that was the result of the testing blitz events that they performed in their communities in the last couple of weeks. I do want to mention, Supervisor Johnson, you had asked for flu numbers for the year. And for 2019-2020 flu numbers so far this year, or this season, there are 1,100 of those. I also want to inform you that at 2 o'clock there is a governor's press conference that we've just learned about. I don't know the content at this point, but ADHS has made us aware of that press conference. And it will start at 2. We have, as you know, a long-term care facility that we're working with out of Bullhead City. We continue to work with that particular facility to educate them and provide resources. They have submitted resource requests for PPE, which I believe we are fulfilling. And then we are also working directly with their staff and any positive patients. And well, actually, they're dealing with the patients. They work directly with the patients, but we're working with any staff that are positive in following up on the investigation. And we will continue to do so there. So that's my update for today.
That's your report. Okay. Are there any questions?
I figured there would be questions.
Supervisor Angus.
Thank you, Denise. A few things. The hospital numbers that you just talked about and that we got in our email, I need you to double check them because the information I'm getting from WARMC itself is different than what I'm seeing on these reports. You just mentioned that you think that there are more beds, but I'm hearing that it's COVID beds. So if you can just please double check that, make sure that we get the correct information. So, and I do want to talk a little about public health's role in these long-term nursing facilities, because we're all on the record and people are asking a lot. I want everyone to understand what exactly the county's responsibility is, what our mission is when we are made aware of these types of things. And then, and what can we do to ensure that these facilities have a plan? What we've learned over the weekend was that there may be some of these facilities may not be as prepared as we would like them to be. And so I think we learned a lot from this one. And my concern is going forward the other one. So what is public health, the county's public health responsibility in that whole situation?
Certainly. And I did bring Lynn Valentine with me. She's our nursing division manager, and I thought she could also speak to this because she works directly with those facilities. Do you think you could address that question?
So we act as a resource and support for them. You know, we will help them with whatever we can, obviously, whether that's arranging testing, for staff and for residents. Obviously, we do case investigations. Really, it depends on the facility's needs, but we are not going in an authoritative role,
Right.
obviously. We are as a resource and a support. That is largely what our role is. Our overall goal is to slow the spread within the facility.
How about the testing itself? Because people have asked, why didn't the county go in right away as soon as we heard about it? And we did. We tested the ones that were in the area where the ones who tested positive, but then we were asked, why didn't we go in? And we're still asked about a lot of other facilities go in and test all the residents. And I want to put this on the record because people have questions about it, as do I.
Part of it is our resources. I mean, that's a huge undertaking. This particular facility, I believe, has well over 100 residents and staff, and we don't have the capacity to do that.
In what way? Your staff, or
Staffing,
because we
time.
now have tests. I know we didn't have tests, which.
Right. We do have access to, that is correct.
So
Yes.
under what circumstance would we actually go in and test? Would there be a situation where that would happen, where we would go in and test everybody?
It really kind of depends. Right now, like that was, as you had spoken to, it was in a particular unit, and we had already gone in and tested almost half of those in the unit. And so we had just a handful of residents who hadn't been tested, so we were able to go in.
Can I ask, when you went in originally, why did you only test half of them?
Those were the ones who had some symptoms.
Right.
So that's usually who are tested, are those who are displaying some symptoms. And in the elderly, that can be challenging because they're not always displaying those
Right,
typical
but
symptoms.
who would make the decision? So you go in and the ones who have it, but they're in a unit and they're together and
Right.
they're sharing the same air. And would it behoove us to, in that situation, to sort of err on the side of caution and go in and test everybody, so it wouldn't be days later that we would find out that, yeah, all of them were positive?
Right, and we ended up, all of those residents in that unit have now been tested. There were a couple who were refused. The families chose to opt out of that, and that's entirely their decision, their choice. And then the staff as well. But really, we can work with the facility as far as helping them to arrange for them to maybe contract with a lab or with another facility who can come in and test
Right.
everybody across the board if they so choose.
And the deaths, and again, and I'm saying this because I think a lot of people are confused, and I want it on the record. The deaths that happen at that facility, I've been told that several of them were already in the dying process. Hospice is coming in, and that's something I want to ask about the hospice workers. And so when they were diagnosed with COVID, even though they may not have had any symptoms, and they die, let's say, the day later, their death certificate says COVID-19. And that's a big topic of conversation out there. It has a lot of, different ideas about should we, shouldn't we, and why do we? I mean, that's what I say, why do we? But we do. And is that what you're understanding as well?
I understand if at the time of their death they had been diagnosed with COVID, that it is included on their death certificate.
Right.
Yes.
Okay. Let's see, what else did I want to ask? So the other larger residential health facilities, do you know for sure whether they are prepared for something like what happened to that facility? Because from what I'm gathering, from the phone calls I'm getting from the facility, I don't believe they are. And I'm thinking that may be a function of our health department to make sure at the very least that they have the protocols, that if as soon as they had one patient positive, that there's going to be a sequence of events so it doesn't happen sort of the way this one happened, and I think that, and I want to say on the record again that I think that they're doing everything the right way, and always have been. It was just a little slower, a lot of reasons, the holiday weekend, everything. But to avoid that in the future, are we doing that?
We definitely have reached out to the facilities on several occasions. We have we have weekly calls available for them.
Available, but are you following up? I mean, are you asking can you, as the public health authority, request that they have a plan that, it gets seen and approved by you? We don't do that, do we?
We have not done that, no.
Do you think we should?
I think we could definitely offer that. I don't know that we could
I think it's better to get
require it.
involved before it happens than have to get involved after it happens.
Right, and it is challenging, and they do, we work with them very closely. As soon as any of these facilities have had a case, they are calling us, requesting assistance, and they do have plans. It's just that this disease has just evolved, and it just is kind of unlike anything we've ever seen before. And so they may have a good, solid plan in place, which is excellent, but, as they go along, it needs to be revised.
I understand that, but when it comes to testing,
Right.
I don't think many of them have a contract with a lab
Right.
or understand that they are responsible, that now it's basically the cost of doing business, and that they are ultimately responsible. That, because what I gathered this weekend is a lot of these organizations just believe that the county was going to come in and do the testing and do all that stuff. But we have a place, but if they don't know what the expectations are from them, and I think that's something we could do before it hits the fan, so to speak. And that personally, I don't know the rest of the board, that's something I think that our health department could be doing a little better. But please check those numbers, because I've been thinking about it for a while. It just seems every time I get those hospital numbers and then I speak to the hospitals or the people involved, they're different.
And for the Warmsy numbers, I just spoke with the CEO yesterday. So that was the conversation, was
okay.
that the ICU beds currently are mainly taken up with individuals that have other non-COVID related illness and injuries.
I think that may have changed. So if you can just double check,
I can.
I would appreciate it.
Certainly.
Get a question about hospice.
Oh, the hospice workers, right. Again, because we're just a small community, we all know people who work in these organizations, and so at this facility that we're talking about, and they've put out a press release, and I appreciate how transparent that corporation has been, and they wanted to get it out there, and people are going to believe what they want to believe, but they've been as transparent as I've ever seen some organization being. But the hospice workers that go in, they have to be tested too. When you talk about community spread, it's coming from these organizations, these corporate, they have, in the beginning of this whole episode, they have locked down their facilities. Only the people who absolutely need to be there, families can't come. So if you have an outbreak, it's going to be brought in by the healthcare workers. So it's so important to, I think, continually test. If you're going to expend tests or resources, it seems that would be the most logical place to do it, is with the healthcare workers. And so is there any plan to ensure that happens, or hold the facilities accountable for making sure that these people are tested and sent home and all that?
We have made arrangements in this particular incident for staff to receive testing over at Warmsy. So any individual staff person that is referred over by public health will be tested. We are also reaching out to ADHS. I just asked for additional resources, and not so much test kits at this point in time, but more people resources. It requires people to collect the specimens, and that's the time and the resource that we need. Warmsy has offered to help us with testing the remaining staff and remaining residents at this particular facility. But ongoing, we would need additional staff to help us with that.
And that's happening today and tomorrow, the testing. So from the day that we found out about it, which was basically late Thursday, Friday morning, it's taken about a week. We went in immediately, and the county did, and tested the people that were in that area that the positives were. And now the corporation came in, and they insisted on testing everyone. They're setting up their...
Correct.
Okay. And so that the worker part of it. And then just one more thing, and then I'm done. I get a lot of calls from people who say, you know, I want to go in and get tested. How do I get tested? And I don't think people know. There are resources available. They can go to their doctors. They can go to labs. So I'm hoping that the county can put out a resource guide, and that maybe it can be in the form of a press release, and then the papers can do it, because I didn't know. I mean, I learned a lot during this episode last weekend, and the resources out there, I just don't think a lot of people know yet. And even if you can't afford it, if you don't have health insurance, there are healthcare agencies that have worked with Access and HCIC, and they will do it for free. So there should be no reason, if somebody wants to be tested, that they can't be tested.
Right. And I do think there are... as we know, the hospitals are providing testing at this point, and we do know that there are likely some private providers. I don't know who they are at this point that are providing testing as well. And the challenge, I believe, is still those individuals that are looking at elective surgeries of trying to find testing. As an example, I just reached out to somebody, a person out in the public, that contacted me about that very question. And there are very few resources out in the community that are testing just for elective surgeries. If you have symptoms, they'll test you. But for elective surgeries, that still is a challenge to find someone, and either a private provider or the hospitals or others that will test those individuals.
That doesn't make really sense to me. So if I'm going in for an elective surgery and I, have the meeting with the doctor, at that point they don't say, this is where you can go to get tested. We require it, so this is where you can go. Like anything, like you have to get a heart test, you have to get these procedures. You're telling me that they don't direct people?
Not that I know of. I mean, there may be some physicians and outpatient surgery offices that do provide that resource, but that has not been my experience so far.
Well, that's interesting. Well, maybe we can put that into whatever information because if we're just advisory and that kind of thing, then it's beholden on us to get out as much information. And I know you guys do a great job, but things have changed. The information people need now are different than the information they needed 2 months ago.
Certainly.
So if we can start doing those kinds of things, I think that would help a lot.
Yes.
Okay, thank you.
Certainly.
Chairman, if I could just comment on some of the things that Supervisor Angus brought up.
Yes, go
just
ahead.
some things to keep in mind, and I'm sure that the public health here knows this, that long-term care facilities are licensed and regulated by the state. It's the State Department of Health that does those things. And in fact, the State Department of Health, they have issued new rules and guidelines specifically addressing the things that you talked about. They passed new regulations that specifically require the administrator of the long-term care facility to ensure that policies and procedures are established, documented, and implemented to protect the health and safety of the residents. Those include cover screenings and triage, cover the manner and frequency of assessing residents to determine a change in medical condition, other things to address specifically the COVID stuff. So it's really not so much, the regulation is not so much a function of the public health, the county public health, it's really the state public health department that's responsible. They would have to do some kind of an arrangement with the county health department to do that. They could work together on things if they have delegation agreements in place. We'd have to determine whether those are in fact there, but there are procedures, there are requirements in place that do require these long-term care facilities to do these things.
Right, but who follows up on it? Who makes sure they do it?
The State Department of Health.
Really? So
That's their responsibility.
I understand it's their responsibility, but we're the ones who are,
No, I get it.
I understand.
And what I'm saying is these people, the county health department do a fantastic job, and they work their tails off, and they are working with the long-term care facilities, but it's also you have to determine which is the proper office to do those things. And by statute, it is the State Department of Health's responsibility. Now, there can be delegation agreements. There are, in other instances, there are delegation agreements that allow the local health departments to do that. And if that's the case, then they will step in and do that, certainly. I just want to make
Have
sure
that
you point that out.
delegation power, you think?
I don't believe we do. Not around licensure. So when we talk about Arizona Department of Health Services and their licensure department of long-term care facilities, that is their sole responsibility.
Can we get something from ADHS saying exactly what we can do? I mean, we are the government closest to the people. And if we're going to wait for them, forget it.
Well,
not gonna happen.
what I'm saying is, I don't think that they have. And I think that's what Lynn was talking about. Is Lynn is working with them. That Lynn was explaining that they did the testing and things like that. And certainly, the health department can ask, "Do you have a plan? Can we see the plan? Can we do those things?" But in terms of just enforcement, the actual enforcement, the next step, that would be something that the state would be required to do. But I certainly think that the public health department will continue to work with them. But as far as the enforcement, you've got to look at, there is the State Department of Health responsibilities to do
I didn't say anything about
that.
enforcement. I just said helping them make sure that they have things in place, that they understand what's here in the community. That's all I said. I'm not even going near enforcement.
But I also just want to make sure that you see that there is that other component. There is another agency that's out there that is also responsible for this too. And I'm sure that they could work together with that.
Ryan, that is on their website, is it
It
not?
is, yeah.
Okay.
Thank you.
Do any other supervisors have any questions or
Madam
comments?
Chairman.
Supervisor Gold.
Thank you, Madam Chairman. Denise, do we have an updated number on the recovered patients?
I believe we do. Just one moment, please. At this point, we have 98.
Good. Thank you.
Anything else? Supervisor Johnson.
We kind of follow up on Supervisor Angus's question. The problem I see is if you go and offer your services, they can basically tell you to pound sand, correct?
That is correct.
Yeah, that's where I have a problem because, and if you go in and say, even if they're welcoming to begin with, and you find something that you go, this is wrong what you're doing, they can shut down. I guess that's the problem I have without having any enforcement. We're always welcome in until we find something wrong, and then we're asked to leave. And is there a reason, or is it just luck so far that we've only seen 2 of the facilities, long-term care facilities hit? We have quite a few in the Havasu area, and I'm just curious about that. And Supervisor Angus brings up the point that obviously people from the outside bring it in, and then I'm even a little bit torn on testing people because if you test them, it takes 2 days to get the results, and they've already been in seeing the people. I don't know how we would test people that would stop bringing it in from the outside. But is there something that, are you expecting the Havasu facilities to get hit?
We actually have a total of 5 facilities that we've been working with throughout the county. And we have facilities in each city at this point that we've been working with. And so, again, they request our assistance. We will go in and help test patients, make arrangements for testing staff, and then also provide education and guidance about what to do and next steps, and then try to work with that particular facility to reduce and prevent the spread.
So you think maybe that's working on some of the other facilities, that's why we're seeing it in a limited number?
Well, I do think there are other facilities that have taken some maybe additional steps, maybe testing their own staff, testing patients periodically, and so they've maybe increased their use of resources in that way.
I guess, beating the dead horse again, but we have 5 of us sitting up here, and if you test us all today, in 2 days, we all come back negative. But in those 2 days, some of us might have been somewhere else, so we're having a meeting 3 days from now. And I guess that's the hard part, and that's probably why it's spreading so badly, I guess.
Very much so. Very much so.
Are you going to, I noticed we're still off on our numbers of deaths, and you were going to do the asterisk thing. Are we going to put that back on our board so we match the state?
So the only way, again, going back to that matching the state question, the only way for us to match the state would be to include those probable cases now. which, if I understand the direction correctly, that we were not going to include probables in our counts. We were going to keep that very clean and clear with just confirmed cases. So if that's not correct, please help me understand that so that we can move forward. But that was because now ADHS is reporting on their dashboard probable cases, both for deaths and for cases. So that will automatically skew our numbers or create a variance in our numbers at that point.
Okay, but maybe that's something we could discuss. I just thought we were going to still hold them. We were just going to put the asterisk and say that we equal out with the state, but a couple of them were just probable cases, but that's something we can work out.
Right, right.
In comparing the press releases to the daily COVID report, the city numbers are not matching up. For example, Kingman is at 214 in our report, but the press release has 213. And Lake Havasu and Bullhead numbers are also off by 1 or 2. Is that something you can look into? I mean,
Yes.
The numbers should be correct.
Absolutely.
And then we had our first positive case occur in our jail. What are we going to be doing there as far as testing our people? And this person was obviously a transfer in from LA County.
Right.
And so were they isolated to begin with? Did they have a protocol to license or to quarantine all new inmates for a certain period of time?
Yes, the jail commander did have a process in place to ensure that they could isolate or actually quarantine individuals that were new to the jail population. And I think he may be better able to speak to the actual details of that plan. But we're working very closely with them on that particular case and then the investigation that goes with it.
Because those things, especially when we're doing transfers in, because then we have the deputies involved in the transfer and everybody in processing. So
Correct.
I think that's all I have today. Thank you.
I see no other questions.
Can I just clarify something? This is all-
Okay, sure.
I'm no way saying that the public health, I mean, I think you guys did a spectacular job when all of this happened, and also Watermark. Everyone's doing the right thing. I just want to, make sure that these facilities understand what their responsibility is and what and what your responsibility is. And I think that's the thing that's been a little off. So if we could give information that would make sure that everyone understands what we do and do not do.
Right, right. No, I
And
agree
think that
completely
would work,
because.
but your department's been fantastic, as
Thank
has this particular company. They've really stepped up, and hopefully it's all, I'm confident that everything is going very well.
Good. Yes, we are there on their property at their request. And I think that may be the misunderstanding, is that we can't demand to go into that facility and do any form of testing. They're a private business, and so they invite us onto their property, request our assistance, and in those cases, we absolutely provide that assistance. That is our job.
And I'm sorry, just to chime in one time, if people need to file a complaint, you can file it online. I have it right in front of me. The complaint is filed with the Arizona Department of Health Services. They're the ones that govern those and enforce those, as Supervisor Johnson stepped in and said. So that's there, so the public can have it, anybody can have it, they can file those complaints through there.
Yes,
Yeah.
absolutely.
Okay, anything further? In closing, anything from you, Denise?
We appreciate your support and your eyes and ears on the community and sharing information with us. We appreciate that. Thank you.
Okay, I'll adjourn this meeting then. Thank you.